involved?
So a Complimentary Rehabilitation Assessment at Dorset Orthopaedics is a free assessment that lasts about 90 minutes, and it enables an interdisciplinary approach of assessment with various clinicians and a client, with case managers welcome or others involved in care, to identify a client's needs, challenges and rehabilitation goals, to look at short-term rehabilitation intervention that might be recommended by the treating clinicians. So during the assessment, the clinicians will look at the needs of the clients, the challenges that might be involved in their injury, and also understand a client's goals, who they are, what they want to do, to put together an assessment report that is very readable by anyone that's non-clinical as well, to understand what short-term interventions might be recommended. So the CRAs are written with the non-clinical reader in mind, understanding that these might be read by the clients, their families, and also funding parties that might not be clinical. So it's quite concise, it's got all the information that is required to help the funding parties and decision makers understand and interpret the information to be able to utilise and make a decision early on as to agreement to the recommendations. So patients, once they get the assessment, we'll be able to look at what the recommendations are, what the rehab journey might look like, timeframes that might be involved, and things that the clients can work on to progress their rehabilitation, which is something that I think is really important, getting that client to have ownership of their rehab journey and their recovery.